A 6-year-old in West Virginia is among the latest victims of the deadly flu epidemic. It is the first pediatric flu death in the state in 3 years. West Virginia's Department of Health confirmed the death yesterday. According to recent data, there have been more than 30 child flu deaths so far this season. That compares to an estimated 21 at this time last year. The virus is now widespread in 49 states. Children and elderly adults are the most vulnerable to flu complications. Our Dr. Tara Narula is here with how to keep your kids healthy. Tara, good morning.
Good morning, Nora.
Why are children more at risk?
We're talking about all children, but in particular children under 5 and even more so children under 2. Why is that? Their immune systems are still developing. They play in close contact constantly with each other, and they don't practice the best hygiene. They don't have the best methods of washing hands, etc. But I think the bigger issue is that in this country, we know that on average only 60% of kids are vaccinated for the flu. We also have data that tells us that 80% of the children historically that have died from the flu have been unvaccinated. And a recent study that said you can actually decrease the flu deaths in 50% by vaccinating children.
So what should you do if you think your child has the flu?
Well, I think you need to call your doctor. You need to speak to them and say, this is what's going on. Should I bring my child in to be examined? Your doctor can then assess whether they would be a candidate for antiviral medications. You want to make sure they rest, that they're hydrated. And then one thing that we teach, I teach my residents and fellows is you need to be aggressive about acting quickly. So if you start to see signs of deterioration, and parents need to know warning signs. So for example, is the child breathing faster? Are they more short of breath? Do they look a little bluish? Are they listless or lethargic, not eating or drinking? These should be signs that prompt parents to say, you know what, I need to take this kid to the ER quickly.
It's also frightening because so many people who've gotten the flu shot are still getting the flu. What do you say? Is there an explanation about why that happens?
Well, we know that the flu virus changes. It changes from the time they pick the strains to put in the vaccine a year ago. It also changes during the production even of the vaccine. So there are multiple different strains, but we know that it is still beneficial to get the vaccine.
How do you keep it from spreading? Some quick tips.
Right. So parents, keep your kids home until they're fever-free off medication for 24 hours. Make sure you're vaccinated as the parent. Your caregivers are vaccinated. Clean the utensils and towels. Don't let kids share them. You want to teach your kids about hand washing, about using sanitizer, not kissing and hugging each other when they're sick, sneezing into their arm or coughing into their arm, using tissues. Lots of great hygiene practices.
All right, Dr. Tara Narula, thanks.